listen, thank you all for coming to what is sort of an official kickoff to almost opening our pediatric unit. We're not quite there yet, but we wanted to have everyone to have a chance to come and tour and see what we're doing. Now, in typical children fashion, we're all squished in together, so that's the way this is going to work. But we wanted to just say thank you to everyone who has been a part of this, to acknowledge how exciting it is to be here. And there's a couple of people I want to sort of particularly acknowledge, and then I'm going to ask some of our elected officials who chose to be here to acknowledge them too. But I got to sort of start with the VIA. The VIA, we wouldn't be here if it wasn't for the VIA. And Carolyn Della Rodolfo and Linda McElhaney, would you just acknowledge us for a minute as our chairman of our board and chairman of the VIA, which is president of the VIA?
There's Linda. You know, we're kind of beaming from ear to ear at this point because this is a dream that we've had for a long time. And my husband was cute last night. He goes, well, you're really going back to your roots when you think about it. And I said, that's true. The VIA has always been concerned about the community and what we should be doing for the community. And for quite a while there was a huge piece missing, and that was pediatric unit. And since I joined the board in 1998, I think it was, that has been a question on the board's lips, is why don't we have a pediatric unit? So now we do, and that piece has been filled. And I have to thank everybody who was involved in getting past those barriers, because there were many. There were many barriers. Every time we talked about it, it was like, it can't be done. So we talked to Jim when we were interviewing him and said, we need a pediatric unit. And he pursued that, and there were a couple of people like Eleanor and Scott who made sure that they found a way past those barriers. And so here we are. And I thank all of you for coming, and those of you who are doctors here, you will now be able to see a little patient and be able to refer them here instead of somewhere else. So thank you very much.
Another very critical role here in support is that we've got kids, but we also, as Carolyn said, the physician community has to really want to be behind this. And when we checked with our pediatricians and asked them to sort of give us a sense of whether this makes sense or doesn't make sense, Pam Harrington and Jason Gomez together sort of worked, their chief of our pediatric department and vice chief at the time, was there to try to survey our pediatricians and ask sort of what did they feel. And they, Pam, would you say just a minute? I know you didn't know you were going to talk, but would you just say something? Because you convinced us we should do this, actually, so it's your fault.
I'll just start by saying this is really a very exciting time for us. It's been something that we've lacked in our community, and our patients have lacked this service for quite some time. It was always frustrating when we would have a patient who we felt needed to have just some basic inpatient pediatric care, and we had to refer them to other hospitals. And this is something that we as pediatricians have wanted for a long time, and Dr. Gomez and I, as well as our department, decided to pursue this. And I do want to thank the hospital staff and the board and the VIA and everyone sort of was on the same page all at the same time, and we're really excited for this, for our patients and for our community.
Okay. And so, and Dr. Gomez was so excited about it, he said, gosh, if we're going to have a unit, I think I want to run it. And so Dr. Gomez will be our new medical director of our unit. Jason, you want to say just a quick word or two?
I'm not going to say anything that other people aren't more eloquently saying than I am, but this is, for me, is a very important thing for our community, and I think that we will be able to provide tremendous pediatric inpatient care for the children of the Doylestown community, and I'm happy to be able to, and honored to actually be in charge of this and help run it with a really solid team we're going to have behind us. And our goal is to provide tremendous pediatric care to the children of this community, and that's exactly what we're going to do. So thanks everybody for all their support, top to bottom, at this hospital, the community, the board, the Della Pennas, everyone's been really, really supportive, and I truly, truly appreciate it. Thank you very much.
One of the challenges about pediatrics is that while it's so important to the community, the financing of pediatrics is not always that easy to make happen. That's one of the reasons why not everybody has a pediatric program. It's only with support of the community in so many different ways that this makes sense. And when we said, well, we're going to need to maybe raise some funds to really make this happen, oh my gosh, the Della Pennas stepped up and said, hey, I got grandkids. I'm going to make sure this happens because I don't want them going any place but here. Lou and Carol Della Penna, thank you so much for what you've done, because with your gift, you're allowing us to kick this off and make this happen. Do you want to say a word or two, Lou? Or Carol?
I try to get her to speak for the Intel and the Herald, but she...
I'll speak. We were thrilled to be able we were thrilled to be able to do this for the community, for our grandchildren, everyone's grandchildren, and it's a very exciting time.
We're so appreciative. Their gift has kicked off our fundraising campaign, which is off to a great start, and we're already well underway. And please know that it's not just this unit. Our pediatric program is one that is going to take care of kids when they're sick, but we're going to be out there encouraging health and wellness, and the program will extend well into the community using our partnerships in a variety of ways to be able to make things happen. So we're excited about all of that. I also want to thank our elected officials who took time out of their day to come in to be a part of this with us. Ken Snyder and Rick Colello from the township, and Stephanie Mason, township manager. Would you raise your hands and be acknowledged? Thank you for coming today. We also have Heather Cavasco, Chief of Staff from Senator Chuck McElhaney. Heather's with us today. Senator and Marguerite Quinn are both in Harrisburg today. They're actually working, I think is what I understand. That's part of the deal. And we also have with us U.S. Congressman Mike Fitzpatrick. And Mike, would you say just a word or two about how important this is to you for us to do this?
Thank you. And on behalf of the electeds who are here, I want to say congratulations to the hospital and to the community. This is a big day. It's a big piece of the puzzle. It's never missing from healthcare in Central Bucks County, but it's being put in place here in the facility. So I also want to congratulate Dr. Comez and Dr. Harrington. We had a chance to speak earlier. Obviously, they had the dream and a vision, but that's not enough. You've got to have the hard work, the perseverance, the resources, the dedication, the tears, and the sweat, and everything that goes along to see what vision, how it becomes a reality. And this is a big day for you, and you did it for the kids of the community. You're dedicated in your profession, but this is over the top. So congratulations to you. Being here sort of proves, and seeing the facility proves two things to me. Number one, that pediatric health care is so central and important to Doylestown Hospital. This is proof. But number two, that we live in an incredibly generous community. Generosity and charity, that you would care for your children in this way and make sure that they have the best. But that we have individuals in our community who step up. Healthcare professionals, individuals who've done well in the community, and Lou and Carol Della Penna, that they would make a contribution, that maybe one day their child, grandchild, may be here, but understanding that there'll be hundreds of thousands of kids that you haven't met, that will benefit from your generosity. When I'm down the nation's capital, I try to describe how fortunate I am to grow up in a place like Bucks County, where we have great healthcare facilities, we've got a vibrant business community, we have safe neighborhoods, but the best part are that we have generous individuals who give of themselves, not just their resources, but also their time as volunteers. You probably have thousands of dedicated volunteers at Doylestown Hospital, and they'll come into this facility here, the pediatric unit, and they'll be able to provide that care to our kids in our community and not have to send them somewhere else. So to Louis and Carol, thank you so much, and congratulations to the hospital. Congratulations, doctors.
Thank you, Carl. So one other group I want to acknowledge before we do the final ribbon cutting. Would all of you who are a part of the team that will be operating here on this unit, nurses and others, would you raise your hand and just be acknowledged today for your work? We're so excited to have you on board. They are just chomping at the bit. And now let's talk about what's really important, right? It's kids, okay? It's kids. This is about a place for you guys, you know? So I need Brady, Luke, and Chase to come out here. You ready? Okay. This really, look at these guys. I mean, they need a place, and they need a place that feels like it's a place to play in, not just to be. That's what we're creating, is an environment where kids and families can all be a part of it, right? Right?